Special Black Ops. You see it. Let's get it. U.S. government warns hospital of cyber attacks. We all know hospitals are super vulnerable. Let's get into the article. I always talk about where I think HIPAA is almost useless. Let's get at it. U.S. government warns of Maui ransomware attacks against the healthcare organizations. The FBI and the United States Treasury Department issued a joint advisory warning of North Korea-backed threat actors using Maui ransomware and attacks against healthcare and public health organizations. Wow, that's FBI, CISA, and the United States Treasury Department. Because ransomware, of course, North Korea make a ton of money using ransomware and, just getting businesses and especially hospitals to pay. Starting in May 2021, the FBI responded to and detected multiple Maui ransomwares attacking and impacting the healthcare sector's organizations across the United States. I mean, let's think about it. It's way back in May 2021, right? This is a year old. So you would think we would be getting a little better at this, but North Korea state-sponsored cyber attacks use Maui ransomware in these incidents to encrypt servers responsible for healthcare services, including Healthtronic health record services, diagnostic services, imaging service, and intranet services, the federal agency revealed. In some cases, these incidents disrupted services provided by the targeted health sector organizations for prolonged periods. The initial access vectors for these incidents was unknown, right? How did the malware get into the hospital, right? Was it somebody clicked on an email? Somebody put a USB drive in there? Somebody hacked the mainframe? They're still not sure how that happened. According to the threat report by the stalwart principal reverse engineer Silas Cutler, Maui ransomware is manually deployed across compromised victims' network with the remote operations targeting specific files that they want to encrypt. Okay, so it's very targeted, very spear phishing. Mean I'm just not encrypting every server in the organization. They going for data files, diagnostics, stuff that's going to make the hospital sweat blood and pay the ransomware. While the Sternware collected the first Maui sample in April 2022, all Maui ransomware samples share the same timestamp of April 15, 2021, meaning, the same person probably did it and, compiled it and sent it out to everybody. So Maui also stands out compared to other ransomware strains by not dropping a ransomware note on encrypted systems to provide victims with data recovery instructions. The three United States federal agencies also provided indicators of compromise, AOC, obtained by the FBI while responding to the Maui ransomware attack in May 2021. They also urged the health sector organizations to implement mitigations and apply a set of measures shared in the joint advisory to prepare for, prevent, and respond to ransomware incidents. I did that video. If you actually go out to CISA, they have a whole website advising hospitals what to do for ransomware, to prevent this. And obviously, it's not working. At the very least, network defenders are advised to train users to spot and report phishing attempts, enable enforced multi-factor authentication across their organizations, and keep antivirus and anti-malware software up to date on all hosts. The FBI assesses the North Korea state-sponsored cyber actors have deployed Maui ransomware against healthcare and public health sector organizations, the joint advisory adds. The North Korean state-sponsored cyber attacks likely assume healthcare organizations are willing to pay ransomware because the organizations provide services that are critical to human life and health. Because of this assumption, the FBI, CISA, and Treasury assesses North Korea state-sponsored actors are likely to continue to target health sector organizations. The federal agencies also highly discourage victims from paying ransomware demands from threat actors behind Maui ransomware and remind health organizations of an advisory issued by the Department of Treasury sanctioning risks linked to ransomware payments. So the Department of Treasury doesn't want any public or private organization to pay ransom. When you pay it, that makes people more likely to do ransomware. Right? But if you're a hospital and you need records, treasuries, even diagnostic equipment, people could die, right? So that's one half a dozen, one or the other. But once again, HIPAA doesn't work very well. CISA's got a ton of advisories and things of how to protect yourself against ransomware. And we talked about that a couple weeks ago with zero trust, right? That's one of the foundations to help you get against ransomware. But once again, hospitals, healthcare providers, urgent care locations. There's a lot of healthcare organizations in the United States. Once again, be safe out here. Professional Black Ops, cybersecurity for the people. Please subscribe.